Welcome to today's channel. I'm Dr. Willie Vidona, popularly called Dr. V. On today's channel, we're going to be looking at an important concept in anatomy, and that is the temporal fossa. As a student studying anatomy, or a medical student or paramedical student studying the head, I'm sure you must have come across this important concept called the temporal fossa. You'll be wondering, how do I answer question if asked on this important topic? And so today we're going to be guiding you on how to answer question on the temporal fossa, like just A, B, C. How do you go about it? All you need to do is to know where it is, know its borders, know its neurovasculature, and then the significance, and you are done. Okay, to put it clearly in more details, let's go straight into it. What is the temporal fossa? The temporal fossa is the depressed region of space. It's actually a fan-shaped depressed space or region on the temporal region, and specifically on the lateral aspect of the skull. Boundaries or borders is bounded anteriorly by the frontal and the zygomatic bone and their processes, superiorly and posteriorly by the temporal line, medially by the pterium, laterally by the zygomatic arc, inferiorly by the infratemporal crest, and then roof by the fascia and muscles overlying that space. Don't forget, we say floor by the pterium as well. And you'll be wondering, what is the pterium? If you want to know more about this, you can check our previous video on the osteology of the head. Now, what is the neurovasculature of the pterium? The first thing are the vessels. Deep temporal artery, superficial temporal artery, and superior temporal vessels supplies the skull, supply the temporal fossa. Now, when it comes to the neck, the innervation of the temporal fossa comes from the deep temporal nerve and the auriculotemporal nerve. It's very important to remember this. One other content you can find on the temporal fossa is the muscle. And basically the muscle here is the temporalis. Remember, we say it's temporal fossa. So the muscle is the temporalis. Temporalis is one of the four major muscles of mastication. So it's one of the major muscles of mastication. So temporalis is the muscle that overlies the temporal fossa. Having known the contents, now what is the clinical significance associated with temporal fossa? The first one is that there could be damage to the pterium. Remember, the pterium is a space that is formed by four bones. And an important structure called the middle meningeal artery passes over the pterium. So in a case of fracture or damage to this region, that vessel could bleed, could lead to hemorrhage, and particularly epidural hemorrhage, blood collecting within that dura mater, which is a serious medical condition if not quickly rectified. Two, if there is a damage or injury to the auriculotemporal nerve, which is one of the nerves that innervates the temporal fossa, it could lead to a lot of conditions and complications. And one commonest is the Frey syndrome, also known as the gustatory sweating, whereby one begins to observe sweat, excessive sweat on the lateral side of the skull, of the head, around the ear and above the ear to the temporal fossa, while eating or perceiving sweet aroma from a nearby food around. One begins to experience this sweating all over that region. That is known as Frey syndrome or gustatory sweating. The third one is, I remember we say one of the major muscle you can see on the temporal fossa is the temporal lips. That muscle can actually be used for facial reconstruction, especially for the eyelid. So part of that muscle can be used for that facial reconstruction, which is an important surgical remedy. So these are some of the clinical significance or correlates of the temporal fossa. At this point in time, I'm sure when next you are asked the temporal fossa, it won't be something difficult any longer. Having known where it is, the borders, the content, the neurovasculature, and its clinical significance. If you have questions, we'll be ready to attend to it as you drop them in the comment section. And then if you find this guide interesting, give us a thumb up, like it, share with friends and colleagues and students, and then subscribe for another important and interesting topic. Thank you.